Hello, everyone. We are back to another podcast episode today. Today, we are actually going to talk about power of therapy, healing, and growth. Today, we have with us Asheley Korf. She's a licensed independent mental health practitioner and also licensed professional clinical counselor. So, Ashley, welcome to the podcast. Thank you for being here.
Hi, thanks for having me.
Yeah, it's great to jam with you on such an important topic in today's day and age where mental health crisis is like being heard of experience in every second household right now almost. So with your expertise we can learn about this topic and understand when to use this wonderful tool of therapy. So maybe we can do you want to just maybe mention what exactly you do, and then where do you help people, and then we can get deep into the topic itself. Yeah.
Sure. So, like you said, I'm a licensed independent mental health professional, also a licensed clinical counselor professional, or licensed professional clinical counselor, depending on how the letters are arranged. And what that means is that I'm recognized by the state to have met the education requirements for behavioral and mental health. For most of us, that's a master's degree level. Sometimes you'll see somebody with a doctorate being a psychologist. And then I have accumulated enough hours to be approved by the state I'm licensed in to operate independently, meaning not under supervision. So that's kind of what those letters mean. And then kind of with what I do is I do typical individual adult counseling, although I do work with adolescents as well. And so I do both cognitive and behavioral therapy approaches, working with people who have concerns that they bring to me.
Okay. So I guess maybe that's a good segue into like how to maybe understand what therapy means, because you mentioned the cognitive and the behavioral therapy.
Mhm.
So in a layman's term, what does these terms mean, and what does therapy really even mean, right? For
Right.
somebody here.
Yeah. So typically when people think of counseling or therapy, they're kind of used interchangeably. Counseling typically refers, like if you want to get into the nitty gritty kind of details about it, counseling usually refers to the verbal communication interaction portion of therapy, where somebody meets with a therapist like myself, and then kind of goes into what's going on in their head maybe, or talks through problems, and then the person that they're seeing, the professional they're seeing, works with them on developing solutions. We add in the therapy portion, and that usually refers to treatment planning and modifications that we're going to ask the person to do, whether it's maybe changing the way they think about something or changing the way they do something, to improve their personal lives. So when we're talking about therapy, that's what we're talking about, is this verbal communication and interaction with a therapist to improve somebody's life.
I see. So therapy is like a nice tool. Basically, can we think of it as like a nice tool to improve our well-being in life,
Mhm.
specifically like the mental well-being aspects, which obviously mental well-being is all about, like that's the center portion of how our physical well-being also is structured. So, and it's obviously all things, at least in my understanding, is physical well-being, mental well-being are all interrelated at the end of the day. Uh,
Mhm.
so when we improve our mental well-being through means like therapy, we can improve our like other aspects of life, and we can be more happier, right?
Yeah, absolutely. Because what we know now is like the mind and the body are kind of like one unit. And so whatever happens to the body happens to the mind. Whatever happens to the mind impacts the body. So it's kind of a much more holistic approach to healthcare. And so you'll get specialists who specialize in the physical side of it, and then you get specialists who work on the more, I guess it's physical, but it's more like what's going on up here that's impacting the rest of you, rather than like getting a cut or a cold or something like that.
Yeah, and it's interesting. Like I think the mind body connection, um,
Mhm.
I think the mind is probably like the least understood part, given,
Mhm.
it's like it functions, it has so many functions, but it's like hard to interpret what exactly it operates at. So I think having an expert like yourself, for example, navigate these kind of difficult, complex nuances and the mechanisms that we are
Mhm.
dealing with. It's like, it's always great, right? Like that way, people like myself, for example, who
Mhm.
might need help, uh,
Right.
we have some people to talk to and get guidance on
Mhm.
how to navigate challenges in life, right?
Yeah, and maybe I need to clarify too. Like when I talk about the mind, so a lot of us in our profession we kind of use the words mind and brain interchangeably, and I
Hmm.
think maybe I should clarify. The brain is like the physical structures, like like the prefrontal cortex, the anterior cingulate, the like all of these different structures of the brain that you can see on a diagram if you pull up an anatomy book. When we're talking about the mind, we're talking about the conscious and also subconscious processes that are taking place. So, your personality, your dreams, your thoughts, your memories, your emotional feelings. That's what we mean when we talk about somebody's mind. Like it's those things that are their experiences of the day to day. Um, and so it's like, yes, you've got this physical brain that's processing everything and it's super cool and it's all interconnected, but the mind is what we understand and can verbalize.
Hmm. So it's like the subconscious, conscious part of it, which makes
Mhm.
our identity, and then the brain is kind of
Mhm.
like the functioning part of it, how it
Mhm.
manifests things, basically.
Yeah, absolutely. So, and I think people maybe get confused, like when they hear us talking about it, like which one do we mean? And it's like, well, we technically mean this, but
Yeah, it's
we're.
like interchangeably used, it seems, pretty much
Mhm.
in many places. And actually, it's also this kind of like explanation is very much like what I've also, growing up in India with like reading some spiritual
Mhm.
texts like Bhagavad Gita. It's also very similar, where it talks about the mind being like this, not the thing that we can easily maybe look at, but then the
Mhm.
subconscious part of conscious part of it is, it's manifesting things through the brain. So I think it's very much
Yeah.
like what I've also pretty much learned through other texts. So it's great to see that. uh,
Yeah.
so it's I think now we understand. So therapy is like a well-being tool that should be
Mhm.
used when we need more well-being help. So maybe we like, let's talk about like, what are some of the instances in somebody's life that they would want to, let's say, approach therapy, right? Like today the problem is, at least, and that's something I've also personally faced, is like the lack of awareness about these tools.
Mhm.
um, like I know, for example, if I'm injured, I'll go to a doctor to get
Right.
treatment, right? But when I'm, let's say, emotionally down, I mean, that's not obvious, at least in many people's minds, that, hey, who do I approach to? Most people go to, like, let's say, the family, friends, but sometimes the difficulties in life are maybe too overwhelming that you need more
Mhm.
expertise to really navigate those things. And people are sometimes super confused. So maybe help us understand, like, when
Yeah.
therapy would be a great tool to leverage.
Sure. And I think maybe something that can help is I'm going to relate it to physical medicine a little bit so people can understand some comparisons of what we're looking at. So what I tell people is, we all get sick, right? I can catch a cold and I can feel miserable and it's going to kind of suck and I'll work through it. I've got a lot of tissues and I've got sinus medication and I'm okay. And I may seem off for several days because I'm dealing with a virus. That's kind of normal within the medical field. And the same thing is true when we're looking at somebody's emotional well being. You have highs, you have lows. That's normal. And as long as those highs, those really high highs or those lows, as long as they're short term, and
Hmm.
they're maybe just within the normal range of frustration or they just kind of take you down a little bit, that's normal. We all have that. So that's like what I call having an emotional cold, you know.
Oh, wow, that's a
um,
very nice term, emotional code.
yeah, so I tell people it's a little bit like having an emotional cold. It's like you don't feel right, you don't feel normal. um, it's kind of impacting you, but you're able to kind of get through it and you're going to be okay long term.
Hmm.
Where I would say you start to look for additional help is when you're not getting better. So
Hmm.
like if I have a cold and I'm not getting better, in fact, my symptoms are getting worse. Like maybe I don't just have, a runny nose. Now I've got severe sinus pressure going on and I'm coughing. And I'm just like, I'm getting more fatigued. Now I have to go see the doctor because I don't know, especially in this day and age, it could be COVID, it could be bronchitis, it could be a sinus infection. There's no way of knowing. And so I'll go get checked out because I need a higher level of attention at that
Hmm.
point. So, looking at that emotionally, it's the same kind of concept. If you're not getting better, if you're fatigued, if you're overwhelmed, if you're constantly angry, constantly frustrated, or even on the other end of the spectrum, if you're always hyper energetic, if you're always hyper like fixated on things, like feeling like you can do superhuman things, like this high end that just isn't
Hmm.
normal, that's also when you want to seek help.
Okay. So if I were to just maybe paraphrase and help me, correct me if this is wrong, but like basically if the lows or the highs are consistently going on, then that's
Yeah.
a sign that, there's something that needs more attention here.
Yeah.
And would we call like maybe consistent lows as like sign of depression?
Yeah. Typically, they're a sign of depression or anxiety. A lot of people don't realize that the two can kind of overlap and manifest with not similar symptoms, but they can kind of overlap each other. So people will miss that maybe what they have going on is anxiety in addition to depression or vice versa.
I
And
see.
then those extreme highs that I'm talking about, those are more kind of indicative of when we look at a mood disorder. And so we're looking at, okay, maybe we need to be addressing a mood issue going on with you.
Wow. Okay, no, that's good to know because I think the
Mhm.
word depression itself doesn't sound very pleasant, obviously.
No.
And like even I think like admitting and saying, "Oh, I have depression symptoms,"
Mhm.
that takes a lot of you can say courage, right? It's
Yeah,
like saying
it's hard.
I'm not well, and that like it's like people are questioning you, what's wrong with you? Everything looks okay outside, and I mean, so many normal people who maybe have like let's say good jobs and let's say good setup
Mhm.
at home, and they're still feeling depressed, and other people will be like, I mean, why are you feeling depressed? And
Right.
you have everything in the life like from a material facility perspective, and I mean, so that taboo itself feels so heavy that even
Yeah.
somebody feeling like they're not okay, they feel hesitant to reach out to help, right?
Yeah, and I totally get that. In fact, I was in that boat. If you don't mind me sharing,
Yeah.
I struggle with depression, and I have since I was a teenager. A lot of people don't realize that about the age of 11, 12 is when a lot of people develop anxiety and depression
Hmm.
disorders, and that's because our bodies are just going through these major changes, and that's
Changes.
when it shows up. And so and I'm in mental health, and so I got really frustrated with myself that I couldn't manage my depression because I'm like,
Hmm.
hey, I'm an expert, I have all these tools, what's wrong with me? And it got pretty severe. Like I can remember not being able to get out of bed and just staring at the ceiling for days because I could not get the energy or the function to do something. And then I finally talked with an expert provider, and they're like, hey, you've got this ongoing clinical depression, we really need to get you on medication for this. And I went, man, that sucks because I'm a therapist, I don't
Yeah.
want to be and I finally got over it. I had to work through it, and I'm like, hey, Ashley, you tell your clients this all the time. Why are you struggling with this? And I'm like, it's hard. It's hard to accept that your body and your mind and your brain are not functioning the way they're supposed to.
Yeah, yeah, totally. And I almost feel like I think most people feel, I think like including many of the people I know of, they're all in denial pretty much that even this
Mhm.
is a real thing in itself, and that it takes like some level of let's say reality check to say, okay, hey, I am at that point where I need help. And I mean,
Yeah.
even like from what you're describing your journey, even experts like you also might need like okay
Mhm.
help at sometimes, and that's like reality of being a human, that we'll all face situations that maybe we need some external help to navigate life situations. So, and which is pretty, I mean, I guess the point is to normalize and say, yeah, seeking help is not a bad thing, right?
It's not, and I think, part of it is, and I get this, is we want to find an alternate solution. Like medicine feels like the last ditch effort for so many people. And I run across that with my clients all the time. It's like, well, let me see if I can do it a different way first. And what I tell people is sometimes that works. There's a couple different types of mental illness we run into, and some of those are biological, where there's something biologically just not functioning right with you. And unfortunately, when we run into that, medication is probably going to have to be involved,
Hmm.
because we have to get the body functioning
Functioning,
correctly.
right? Yeah.
But there's other people who experience like anxiety and depression and burnout because there's just too much happening in their lives, and they're overwhelmed and they're exhausted. And so I'm like, if we address those pieces, then yeah, you may naturally be able to recover without any help.
Hmm.
But I tell people, think of medication as like, it's it's like the net under a high wire. Yeah, you can maybe walk across the high wire safe by yourself, but I love having that safety net in case you fall off.
Yeah, and I think you mentioned these also the burnout, the transitions and
Mhm.
whatnot, and that's like something very difficult. And you're mentioning your journey about like how at the age of 11, 12, body's changing so fast.
Mhm.
And so in general, it feels like, looks like then that the transition periods are like, I mean, burnout is obviously can happen
Mhm.
unconsciously if we have not thought through things and we are just
Right.
going after one after another in things in
Yeah.
life. And then the transition periods, if we are proactive enough, we'll be knowing that, hey, I might need help, and we might not
Mhm.
go to the extent enough that we'll cause that much damage to ourselves, and we seek help early on, right? That's probably a good idea, right?
Right. And everybody has a different level. Uh, I use a lot of analogies when I talk. So I tell people, think of it like a battery. Everybody has different types of batteries. Maybe somebody has like the really big, double D battery type of thing, and somebody else may have like the little tiny AAA battery. That's kind of how we can handle stress. And so some of us are better at handling a lot of stress, other people are not. It's not somebody's personal fault. It's just kind of how you are genetically designed.
Hmm.
And so what I hate is when people compare themselves to somebody else. And I'm like, it's not about what they can handle. It's like, what are you capable of
Hmm.
handling? And did we go above and beyond what you can handle?
Wow.
And that's where I see a lot of anxiety, depression, and burnout occur.
That's like such amazing point. It's like,
Mhm.
I mean, physical stamina is different in
Mhm.
different people. Some people can do gym for 4 hours, some can only do half an hour. And I mean,
Yeah.
nothing wrong or right. It's more about what you can handle.
Right.
So it
And we
seems,
can all do different things too. Like some
yeah.
people love to go running, other people go swimming, some people weightlift. I love to bicycle. I can bicycle for 20 miles, but if you ask me
Wow.
to run, I'm going to maybe make it a quarter of a mile before I die. So, you know, it's kind of like recognizing what can you take on,
Hmm.
what are you attuned to, because like I can handle a lot of certain types of stress because of my training or just because of what I've experienced in my life, but there's other things I've never experienced that could maybe just come along and completely flatten me in an instant.
Hmm. And then having that self-awareness also, what is my stamina? That is very,
Mhm.
very difficult, by the way. At least my
Yeah.
personal experiences, it requires so much conscious work to even know what is my limits.
Mhm.
Like
Mhm. We're
physical limits,
terrible at
yeah,
it.
we're terrible. And because the physical limits are easier, okay, I'm tired, I just need to sleep.
Yeah.
Whereas mental limits, okay, how much am I stretching? Where I'm like, okay, point of anxiety, that's not easy to, at least I have not been able to look at it. Is there easy ways to even like find out what's my limits?
So, and honestly, I can't remember where I've read this. This was way back when I was in grad school, but I seem to recall like people can handle a maximum of three stressors at a time. And anything over three, that's where we're pushing into that overwhelm burnout limit.
Hmm.
So I tell people, start looking at what's going on in your life. Maybe take a literal list inventory of what you're dealing with. And what you want to do is rate the stress on, I don't know, a scale of 1 to 10, for instance, like 10 meaning I'm going to collapse if I have to deal with this another day. And you want to rate those stressors. And if you have anything in the like 6 to or 7 to 10 category and you've got more than 3 of those, that's your warning sign.
Wow. And
Mhm.
actually, the insights you have given, I mean, I'm actually going to start doing the journal, adding this to my journaling, because
Yeah.
it seems lovely that there is now just a very easy, intuitive way to be able to know even
Mhm.
how many tough situations I'm dealing with. And once we point them, then that's like a
Mhm.
easy reflection of, hey, I will need help now right away.
Yeah. Yeah. And the other thing too is you can look at those, and I tell people decide if they're going to be like short term or long term, because maybe you have a project with a deadline, right? But that deadline is in a week. So yes, your stress is way up here because you're approaching deadline. You want to knock this project out. You want it to be good. I think we've all seen what happens when software engineers release a beta tested product and it's a disaster.
Agree.
Type of thing. So it's kind of in that zone of there's a short term stress
Hmm.
and it's going to be gone after a certain period. So it allows you also to keep perspective of
Hmm.
where your stress is and what's keeping that stress level going.
Hmm. So do you recommend also adding like this techniques like journaling with the
Mhm.
guidelines you have given, the template you have given? That feels like
Yeah.
that's a good way to start maybe reflecting on, hey, where I need help and when I need help now, right?
Yeah, and I love journaling, not necessarily in the sense of like what people might think of journaling, like the old Dear Diary
Yeah.
entries. I think of journaling as more like what do I need to get out of my head and see in front of me to make sense of it.
Mm.
So even if you're just doing a bulleted list or like like if you do your grocery list, right, type of thing, in my mind, you can be doing something like that for stuff that I need to prioritize for the week to reduce my stress.
Mm.
And I tell people pick what can't fall apart versus what can fall apart. And everybody's like, well, nothing can fall apart. And I'm like, no, 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 something can. I
Yeah.
promise you, something can break. It's going to be fine.
Yeah, and it's like I think like when I was reading this book, Seven Habits book, Steve
Mhm.
Covey talks about this urgent and importance matrix, and not everything in life is important and urgent, right? Some things can be important but not urgent. And I mean, I think that when we have that segue of prioritization, then we really can delegate or even uh, you know do things later in the time, and that way we have buffer to do only minimal things that we can handle, right?
Right. And I feel like a lot of us get stuck in that concept of everything's important and everything's urgent. There was I don't know if you've ever seen them, and maybe you'll understand the image is like there's these acrobats who will go around with sticks and plates spinning on top type of thing. And so you watch the person running back and forth between every stick to make sure the plates don't fall and hit the ground. And we
Yeah.
take on that same attitude about everything in our lives. Like we can't possibly let it fall. And, so we're constantly running back and forth, but that's exhausting.
That's such a nice analogy, the acrobat analogy. I mean, when I
Mhm.
visualize, I'm like, yeah, okay, now it's making so much sense already. Yeah.
And it's like, and I get that. And I'm like, yeah, we have plate spinning, but keep it down to the number you can handle.
Handle.
Don't one of the just a tip that I give, and I actually just gave this to my university students, was I like the rule of three is for every two things you agree to, you have to say no to something.
Hmm. And saying no, I feel is, I don't know, intuitively as human beings, we're wanting to be a good person that shows
Yeah.
up, right? And that's a hard skill that, I mean, I've definitely
Mhm.
struggled with it. I'm still struggling, but I think
Yeah.
at least I'm starting to learn that, hey, I only have limited capacity. And only after so much burnout, I'm now learning the hard way, unfortunately. But I think that's like a great rule. If you say yes to two things, then say no to one thing. That
Right.
keeps us in check, right?
Yeah, because like I said, I don't remember where I read it, but it was like that three stressors is our max. And so my thought was if you are saying yes to two things, you've got to say no to that third thing because then you're staying under that three.
Yeah. I
And you're
love the
right.
rule of three. Yeah, I love that.
I know. And you're right. People struggle with that because we want to be nice, we want to be kind, we want to be generous, we want to support each other. There's also people who are really afraid of saying no because they're afraid of the conflict. And that's a, totally different issue sometimes, but it's one of those things of you have to take care of yourself in
Mm.
order to continue helping people. And if you're
Mm.
killing yourself, you can't help anybody else.
It's like that airplane when we go and they're like, wear your mask first, then
Yeah.
you help others. I think that
Yeah.
somehow, I don't know why as human beings we are still operating the other way. I mean, which is intuitive that, yeah, if you are not well, you cannot help others. But I think that somewhere we are like trying to be good outside, that image of being good, nice. That's like,
Mhm.
I think some conscious work needs to be done by every individual probably to be at a situation where they can follow your guidance that you mentioned, right? Yeah.
Yeah, I feel like, using that airplane analogy, it's like we all think we can hold our breath longer than the person next to us, and so we'll be fine.
That's not how it actually works in reality, though. That's interesting. So, I guess on just a topic of like, is there different types of therapists also out there, or is there like some specialization when we are looking out for people that can help us?
There are a lot of specialists. So there's two different kinds of licenses out there. There's like a licensed professional counselor, which means somebody like me who has a degree in psychology. There's also licensed clinical social worker, meaning they got their degree in social work. Um, same concepts, just different uh, background degree. And then when you're looking at what we do, it's kind of, again, I'm going to go back to medicine. You can have a general practitioner, right, who sees everybody for everything and then will refer on to specialists. I'm kind of more in the specialist category. I specialize in ADHD, I specialize in bipolar and mood disorders. I specialize in anxiety and PTSD and trauma disorders. So that's kind of and sometimes I get OCD kind of mixed in with that. So that's kind of my wheelhouse. But there's other people who specialize in play therapy or art therapy or equine therapy. I'm seeing a lot of people who do somatic therapy coming up now, which is body movement to help kind of address anxiety and trauma that maybe is in the body. So there's drug and alcohol therapists, people who are specially trained to work with addictions and
Wow.
substance use. So we have like lots of specialties, and sometimes it helps to look up that kind of specialist if you have a specific issue you're dealing with.
Wow. Oh, these are like quite, this therapy in itself is quite a big field, looks like. And
It is.
like medicine is basically expanded a lot into specializations now. Yeah.
Yeah, we've come a long way since Freud and psychoanalysis.
Oh, that's really impressive. I mean, the field is improving and like
Mhm.
expanding to serve the needs of the society. And I mean, people like you are doing great work, like just being there to help the people in special disorder needs, right? Right.
Yeah, and there's people who specialize too in like the size of the group they work with. Like I do individual, I do one-on-one, but there's people who are specialized in marriage and family or couples counseling. And then doing family groups, and then there's people who are specialists in group counseling specifically. So there's all kinds of specialties in our area.
Nice. And like also, is there any, let's say, resources? I know like different companies offer mental health benefits through different
Mhm.
apps, but uh, outside the mental health benefits offered by employers, is there also other ways to find people like yourself, for example?
Yeah, so I am a huge user of psychologytoday.com. And the reason I say that is it is kind of like the Google search for therapists. Now, granted, this is therapists who have subscribed to the resource, so it's not going to just find everybody with a license. But it's kind of like going on to a website and you can put in your zip code, you can put in your insurance, you can put in maybe the issue you're looking for help with, and it will populate a list of therapists or professionals in your area that do that. And I find that extremely helpful. I use it for referrals. I use it for people who need psychiatric evaluation for medication, psychological evaluation for testing. Like maybe they don't know if they have autism and they need to get a test. So I use that as a tool myself for finding professionals that I can refer over to.
Wow, this is such a important tool. Honestly, I was not aware that there is something called psychologytoday.com. So, I mean, we'll definitely share it as part of our
Yeah,
podcast. So that people should find experts like you and seek, the right guidance. So many people are struggling in life. So that's
yeah.
good. Yeah,
I
go
wish
ahead.
people knew about these tools because it's like they're so helpful in tracking down resources, and I feel like unfortunately it's like one of the world's best kept secrets, and it's not meant to be.
Yeah, exactly. I mean, yeah, like doctors we can find through our employers. Why are we not able to find these tools also?
Right.
So it's definitely we need to advertise and socialize it more that people can find
Mhm.
help. Yeah. So in terms of therapy, now we know there's so many specializations, and then we have some tools also like Psychology Today to
Mhm.
figure out the therapist. How do we kind of also understand whether we are getting benefits of the treatment, right? Because in physical health, we clearly know it, right? If I'm sick, I go to the doctor, I get medicines, and I feel better already body wise. But then
Right.
mental health again is not easy to measure, right? Like the body temperature and all of that.
It is. It
It
is. I
is?
hate to say that.
Oh, wow.
We have gotten a lot better about this. So, and this might be something people are also not maybe not aware of is so when you go in to see a therapist, we create these treatment plans. And so if I have a client, I'm trying to think something, what would I say? If I have a client who has a lot of anxiety, I'm going to create a treatment plan based around, okay, client's problem is anxiety. The goal is to reduce anxiety, negative thinking, kind of, and the symptoms that go with that anxiety, which might be like, feeling shaky or, heart racing or something like that. Whatever symptoms they've told me that they're struggling with. Um, and so I'll create a step by step plan of what I want to work on with them. And so I will be evaluating them to see if they're meeting those goals. And most of us as therapists will have like a kind of in our head, or at least on somewhere on paper, we'll have a timeline of when we're hoping the person to start seeing improvement in making those goals.
I see.
Um, and so like depending on what the person has is the timeline I will give them. For some issues, it's very quickly resolved and it can be like within 6 to 10 weeks.
Hmm.
For other issues, it takes a little bit longer type of thing. Um, and then for more serious issues, the person may need much longer
Longer
care.
time. Hmm.
Yeah, like and for a lot of traumas, sometimes the person's looking at maybe 1 to 2 years of care because it's just a much deeper issue. But we actually have assessments that we give our clients, or we should be giving our clients, to help measure if they're making progress. And those can be like the there's the GAD-7, which measures somebody's anxiety level on a 7-question questionnaire, and so we keep track of that. There's the PHQ-9, which measures depression symptoms on a 9-question questionnaire, and so we can watch their scores if they go up or down, if they're making progress on things like that.
Wow, it's amazing that we have like now the kind of standardization to even
Mhm.
measure things, because then that simplifies, I guess, for providers like you, and then maybe
Mhm.
people who are taking treatment, that they're
Mhm.
all at least knowing whether they are progressing, regressing, and then the plans can be adjusted accordingly, right?
Yeah, that's the idea behind it. And so, ideally, you try to get it from your clients maybe every 2 weeks, maybe at the lowest once a month type of thing, just so you can see month to month how things are going. It depends on how long you're planning to see them, or if their insurance, like some people have insurance limited to, say, 10 sessions for an issue, maybe 12. So maybe you would give the evaluation every other session just so you can see if you're making progress quickly.
Nice. That's wonderful. So maybe
Mhm.
this is a great segue into also kind of like, if there is any, let's say, stories, testimonials you have in mind that you feel like it's worth sharing with people. So
Mhm.
because I mean, I've seen like examples are the most motivating, because when you see, for example, like let's say your friend getting sick and getting
Mhm.
benefited from a doctor, you're more tempted to go to that doctor to seek
Mhm.
help because you have some implicit trust that, hey, somebody got benefited, maybe they are good as a provider, because there's too many providers also out there. It's not easy to know who will work well for me, right? And
Right.
with my case. So maybe if you have any things you are comfortable to just share, or yeah, whatever. Yeah.
Yeah, I was thinking it's like it does, and that's something you said that's so important is it is the relationship between the therapist and the client, and I can't put enough importance on that. And I know a lot of people will be like, well, I feel like I have to go to this person, and I'm like, no, don't do that. It's not about whether the provider is a good provider. That's not a judgment on the provider type of thing. It's more like, do you get along well with this person? Because ultimately, when I see people, I'm like, you are giving me your trust. And
Exactly.
I need to make sure that you feel I'm safe enough to open up to me. And so I want to make sure that we're connecting, that we have good chemistry in talking, because if I seem overbearing or scary or intimidating, it's going to be harder for somebody to trust me and do the work I'm asking them to do. So I think what you said right there is a huge piece of it, of make sure you're finding somebody that you connect with, that you feel safe with, that you can trust. Um, and then you'll start to see like this improvement. And I have seen clients who I just don't connect with, and they're stuck. I can't get them to move at all. Um, and a lot of it is I don't know how to kind of get past the boundaries or the barriers. They may not know how to connect with me. And it just makes it really hard for me to kind of figure out, okay, what does this person need? And it usually ends up like me having to transfer them out to somebody else, because I can't make progress. And it's not their fault. It's not my fault. We're hitting
Not,
this impasse and
yeah.
can't get there. But I've had other clients where like I can think of it as like it's, whether they're more cautious coming in, or whether they have this attitude of I got to get rid of this type of thing. It's when they decide, and it's a true thing, when the person decides, I'd rather deal with what's in front of me than struggle. That's when I see the most growth happen. That's when I see the healing occur. And it
Mm.
goes really fast after that.
Wow.
Um, yeah, really fast. I worked with somebody who, trying to think, like I've used this example for teaching too, because it was several years ago. But he was seeing me for PTSD, and he had this legal pad. I asked my trauma clients to write out the injuries that we're going to be dealing with,
Yeah.
and he came in with this legal pad, and it must have been 4 pages long of trauma.
Oh
And
no.
I was just like, oh, like in my head, I'm like, oh, well, we're going to be here a while, kind of,
Yeah.
kind of thing. And he asked me, how long is it going to take to get through all this? And I'm like, well, to be honest, I don't know. That's on you, the person. And to his credit, he committed to it, and he got going on that thing, and it was like a snowball rolling down a hill. Took a little bit, but once we gained momentum, he just plowed through those, and we were done in a year. And I could have sworn we would have been there like 2 to 3 times as long. But he was determined to get through his trauma, and he took the work we were doing in session, and then he took it home and did it at home, and then he came back and he had made progress, and I'm like, holy cow, this is amazing. So I've seen both sides of it. I've also seen people who are very nervous about doing the work away from the therapist. That happens a lot. That makes a lot of sense. So maybe we're a little bit slower in making progress because they want the safety of having me, or whoever they're working with, around to help guide them. So it kind of depends on the person what kind of progress we'll make, but it's literally when they connect with you, that's when you see things start to happen.
So it seems like, just to also maybe paraphrase what I understood, was
Sure.
connection with the therapist is very, very critical.
Mm-hmm.
And
Mm-hmm.
then it seems like um, the person also has to put a lot of work. You cannot just like, it's like doctor can give you medicine, they cannot make you forcefully eat that, right? So it's like we have to I mean, people who are needing treatment have to do self work also, which I think
Mhm.
people, I feel like, at least when I generally chat with people I know of, not many people are wanting to put that hard work sometimes, and they're like, yeah, this is too much, you're asking too much. And it actually, the self growth doesn't come easy, uh,
Right.
right? So but then it is worth it, because once we grow, then we've evolved as a person, and that's a beautiful thing of
Yeah.
part of being our human life, that we can evolve and grow.
Yeah, and I'll go back to my medical analogies. Is like I tell people, you need to think of mental health therapy more like physical therapy, right? If you have an injury, right, and it's healed, you still need to go in for physical therapy sometimes because the movement is limited, right? So you go in to see the physical therapist, they're going to assess how much work you need. That's the same thing as what I do when somebody comes in to see me. I assess where they're at and how much work we need to do to get full range of emotional mobility back. And the physical therapist then lays out the treatment plan. They do the exercises with you, but then they hand you the homework and say, here, go do this at home now. Um, and then it's up to you to repeat those exercises at home. If you do that, you are going to get stronger faster. If you only do those exercises when you go to the physical therapist, you're going to make improvement, but it's going to be at the slowest pace possible
Yeah,
because you're only doing it once a week or
yeah,
twice a week or whatever it is.
yeah. Yeah, that's amazing. I think that I love your analogies, the personal therapy, the physical therapy
Yeah.
versus this mental well-being therapy. So
Mm-hmm.
that's great. So I guess maybe if we were to just like kind of go over all the points we discussed, so
Sure.
therapy is more like, a very nice tool to, have good mental well-being, for healing, growth. And the idea is always that we should be first mindful that,
Mm-hmm.
we should do reflections to make sure how many different types of stress we are dealing with at once.
Mm-hmm.
We can even number them,
Yeah.
and that way we are cautious and even self-aware that we need help now.
Right.
And
And
then
if somebody's telling you you need help, maybe take that seriously.
yeah, yeah, exactly. And I mean, there are people around us, maybe they will
Mhm.
sometimes, if they are nice to us and they are, let's say, having our well-being in mind, maybe
Mhm.
they will also guide us and tell, hey, you
Yeah.
should seek more help now.
Yeah.
And then there are many types of therapists. Looks like there is a lot of specialization depending on
Mhm.
the disorder we are dealing with. So we should figure out which disorder we need help with, like how with medical also, we figure out which special doctor we need, right? So it's similar, looks like. And
Yeah.
then, yeah, yes.
Well, I was going to say, and even if you don't know, that's okay. Go find a general practitioner and they can help guide you.
That's an easy way. Not everybody may be equipped or having all the resources to even figure out
Right.
where to start looking now. Okay,
Yeah.
that's good. And then in terms of selecting a therapist, there is good tools like Psychology Today where people can find experts like yourself, right?
Hmm.
And then the work of the not only the provider but also the person taking the treatment, the person taking the treatment have to put a lot of effort themselves also, to make
Yeah.
sure the all the recommendations, guidelines being given by the provider are actually being, let's say, worked on by themselves, right? So they can see the benefits and they can grow.
Yeah. Yeah. Absolutely. And I encourage people, to use assessments for themselves too, because then they can track. Look at the homework you've been doing. Are you getting better at doing your homework? It's really affirming, and I think it really encourages people that, hey, no, I'm not just wallowing here and stuck all the time.
Yeah. No, it's amazing. I think like this talk is great, and I hope that from our conversation, lot more people who are struggling with mental health and so many other disorders can go out and, with courage they can say I need help, and they can start working on themselves, because every person that gets better and healed, they will make a so much positive difference to the society, right? Like, and I mean, at the end of the day, society is one person adding up, as is that's the community and society we are living in, right?
Yeah, absolutely. And it's like, it's the whole like the stronger we are, the stronger we are together type of thing. And I recognize it takes a lot of courage to ask for help, but it's like if you can get past that fear of asking for help, you're going to get better. You're going to be able to do so much more. And it's just, I just can't talk enough about the benefits of being healthy and whole.
Yeah. Do you have any other concluding points to add, or maybe anything that you'd want to say?
Trying to think. I'm gonna say if you're not sure if you want to get help, that's okay. The one thing I say is when you're ready, you're ready. But if you're not ready, maybe that's not the time for you. And if you know somebody who needs mental health, keeps suggesting it, recommending help to them, even if you can tell they're not ready. Because it's you never know when somebody's gonna be like, you know what, I should go get help. They've been talking to me about this. I should probably listen. So I'm going to say one, do it if you're ready, and two, if you know somebody who needs help, keep encouraging them to go. It's the best thing you can do for them.
That's wonderful. No, very nicely said. Thank you, Ashley. Yeah.
You're welcome.